The goals of joint replacement surgery is to restore pain-free range of motion and return you to your prior activities. Being well informed prior to surgery will help in your postoperative recovery. Here are a few answers to frequently asked questions. You can find additional information at the hip and knee replacement website.
Evidence shows that engaging in preoperative strength and flexibility programs can improve your outcomes after surgery. It's very important that you stay mobile and active before you're having surgery so that you do not become deconditioned. If you're already using a cane or a walker or having difficulty walking, you may want to discuss receiving outpatient physical therapy with your surgeon or primary care physician. This may assist with better outcomes post-surgery.
Think about how surgery will impact your daily life and plan ahead of time. This may include going grocery shopping to stock your kitchen or preparing meals that are easy to assemble or heat up. By doing this, it will help you avoid standing for a long period of time, needing to reach up high, and having to carry anything heavy, as this may be initially challenging after surgery. You can also prepare your home by removing throw rugs and other tripping hazards. Be sure you have clear paths for where you'll need to walk around in your home. Additionally, loading and unloading the dishwashers, washer and dryer may be more difficult, so completing laundry and dishes ahead of time will only help in your recovery. There is no need to purchase mobility equipment such as a walker, crutches, or canes, as those will be provided to you. Some pieces of equipment, such as a bed rail, shower chair, or additional adaptive equipment like a shoehorn, long handle equipment, and a sock aid may be helpful if you think you will need them following surgery. If you live alone, preparing prior to surgery will be very important. You will want to consider scheduling your surgery for when a friend or family member is available, as you may need some assistance at home and you may not be able to drive for 2 to 4 weeks. At a minimum, having an identified support who is able to stop by and check in during the first few weeks would be ideal. If you live alone and you do not have any social supports available, there is an option of privately paying for assistance. It is rare for patients following a joint replacement surgery to discharge to an inpatient rehabilitation unit, and therefore it is important to prepare with appropriate supports for a home plan. You will discuss social support and preparing for your surgery with a case manager prior to your joint replacement surgery.
After you recover from anesthesia and your pain is under control, you will see physical therapy to help you get in and out of bed and negotiate your home environment. As you begin to move, you might feel lightheaded when you first get up, which is expected after surgery. The physical therapist will closely monitor your blood pressure during this time. PT will teach you how to walk using a walker, crutches, or cane. You will be allowed to put as much weight as you can tolerate through your leg. PT will teach you how to perform stairs if you have them in your home. They will practice with or without railings depending on your home setup. If you're having a total hip replacement, the precautions will be determined by your surgeon and also reviewed by your physical therapist. PT will review swelling management using ice and elevation.
To get in and out of a car, it is optimal to move the passenger seat as far back as it will go and slightly recline it. This will give you more space to get in and out. You will want to sit first and then bring each leg into the car one at a time. The reverse is true for getting out of the car. Bring one leg out followed by the other and have them planted on the ground while someone hands you your walker or crutches, and then proceed to stand.
The case manager will order home physical therapy starting the day after you return to your home. You should schedule outpatient physical therapy now, starting 2 weeks after the date of surgery.